This meeting is now being recorded.
Well, good evening. Welcome to the EDS Awareness Educational Series webinar. My name is John Furman. Before we introduce our speaker this evening, we'd like to give an overview of our free program to those attending for the first time. So we'll go over who we are, what is our program, some upcoming events, introduce our speaker this evening, Dr. Chiaramonte, and then we'll have an opportunity for a Q&A. So again, my name is John Furman. I manage the National EDS Awareness Program based in Cincinnati, Ohio. My daughter Deanna, who is on the call also, leads the Cleveland, Ohio EDS support group. She was diagnosed with EDS in 2008, the same year my wife Carol passed away with breast cancer. I was a caregiver for my wife who struggled with undiagnosed EDS for over 30 years. So we introduced our program at the EDNF conference in 2012 to help EDSers form independent local support groups and spread EDS awareness in their communities. We started over 100 groups to date. Each group is given their own free website with a link from the directory and map. We've received feedback that conferences provide valuable information and social opportunities that many cannot afford physically or financially to attend in person. So we decided to bring the speakers to you through the free EDS Awareness Educational Series. We meet every first and third Tuesday, typically at 7:30 p.m. Eastern Standard Time. All the programs are free. The meeting announcements and whenever possible, the webinar recordings will be posted on our website at edsawareness.com for later replay. You can receive email announcements for future sessions by requesting the free guide on our site. Tonight's presentation is sponsored by Body Support Store, where you'll find over 250 products selected by EDSers for EDSers. The store is the only funding for this program, and it usually covers our monthly web fees. Please visit our store and check out the helpful products that we offer. We also have an additional sponsor this evening. Elizabeth Shaw had a Hoofbeat Run, Walk, and Roll in August and raised some funds to help support our webinar program in King Ferry, New York. Just a general disclaimer. This presentation contains general information about EDS. Members of the EDS community voluntarily participate in this program. The information is not advice. If you're having medical problems now, please call 911 or the emergency services in your location. Always consult your doctor before making any changes to your treatment.
Be sure to mark your calendars for our next webinar on October 18 at 7:30 p.m. Eastern Time. Our presenter will be Dr. Heidi Collins. To view upcoming speakers, see the webinars page at edsawareness.com or chronicpainpartners.com for the full webinar schedule. For those attending live, there will be an opportunity for Q&A tonight after the presentation. Add your questions at any time by clicking the Q&A icon located at the top of your screen. After typing in your question, click the orange button to submit. Our speaker tonight is Dr. Delia Chiaramonte, and her topic is an integrative approach to pain management. Dr. Chiaramonte is Assistant Professor of Family and Community Medicine and Associate Director and Director of Education for the Center for Integrative Medicine at the University of Maryland School of Medicine in Baltimore. She is board certified in family medicine, hospice and palliative medicine, and certified by the American Board of Integrative Holistic Medicine. She has been in practice for more than 20 years and has expertise in the integrative approach to pain management, mind-body medicine, and integrative stress management. She is the mother of 2 teenage girls with EDS. So we're especially interested in all the wisdom that she has to share with us tonight. And Dr. Chiaramonte, I'm really looking forward to the presentation. And we're going to go ahead and start loading your slides. And
Sure.
Welcome. I'm going to turn over the microphone to you now. Thank you so much for being here with us.
Terrific. Thank you so much for having me. I really appreciate it. All right. So we're going to talk about the integrative approach to pain management. In EDS, as in many other conditions, there are all different kinds of pain, and just as we're starting to think about pain management, I think it's a good idea to remind ourselves of the different kinds of pain that we might be talking about. There's nociceptive pain, which is the maybe most typical pain that we think about that comes from soft tissue injuries or from joint dislocations. There's myofascial pain, which is somewhat more complicated and usually happens when pain's been going on for a while. There's neuropathic pain when the nerves are involved. Visceral pain, which comes from the stretching of organs. Often that results in abdominal pain. And then there are some very specific pain syndromes which are common in EDS: headache, painful periods, vulvodynia, which is pain with around the outside of the vulva, pain with sex. And then in any chronic pain syndrome, you can get something called central sensitization, which we're going to talk about in a few minutes because the integrative approach is particularly effective for that. Okay. Now I'm going to tell you something that you already know, but I want to give you the words to talk to your providers about it because not all providers think in this way. Medical providers often think about, do people have acute pain or do they have chronic pain? So if you just got injured, that's acute pain. If you've had pain that's been going on for a long time, we call that chronic pain. But if you go to your doctor and say, yeah, I have had this pain for a long time, or it started, 5 years ago and now I have it today, the doctors may be thinking you have a chronic pain syndrome and not realize that particularly in EDS, both kinds of pain happen together. Serial acute pains, so a dislocation or a subluxation that then gets better but then happens again, and maybe particular pains that have themselves been chronic for a long time. So I think it's really important to realize and to have these words for EDS pain that it's unusual in the pain world to have both serial acute pain and chronic pain, but in EDS that's exactly what happens. And it's important to think about the difference because the way we treat them is sometimes different. Okay. So we're just so you know, we're going to start talking a little bit in general about pain and what the newest knowledge in pain is, and then we'll talk about specifically different integrative ways to approach it. So way back when, people thought that pain was pretty simple, that you stepped on a tack or you had a particular pain in a joint, a signal went up to the brain, you perceived pain, and that was it. But it turns out that that's really not the case. There are signals that go up, but how the brain perceives them is highly affected by a lot of things, including our genetics, but also what we're thinking about the pain, what we're telling ourselves about the pain, how many social connections we have, and what kind of inhibitors we have coming from the brain going down. So there's the signal that goes from the pain up to the brain, but there also are very important signals that go from the brain down that can modulate how severe that pain is. So pain is much more complicated than just you hurt a joint, the brain perceives it and feels pain. Much more complicated than that. So the basic concept that is really important, and when we talk more about what we can do about pain from an integrated perspective, you'll see why this is so important. It's really the brain that tells us whether or not we have pain. And the way the brain works in perceiving pains, the more of a threat that the brain perceives, the greater it perceives the pain to be. So the more of a threat we have, the more it hurts. And it's not that people are scared and they think it hurts. No, the brain actually changes or modulates how it perceives an input based on how big the threat is. So just as an example that doesn't have to do with EDS per se, but people who have mastectomies, those who are very worried that their pain will come back have greater pain. So the more threat we have, the more we perceive pain. And sometimes the medical community inadvertently increases people's sense of threat by looking at an MRI or an X-ray and saying, oh my goodness, it's bone on bone, look at that, no wonder you have pain. Well, we've just increased the threat level of your brain and increased the pain, made it harder to treat. So it's very important that we realize this because often we ourselves can work on the threat perception that we have. And we do know that pain is not just about what's happening in the tissue, because if that were true, then there wouldn't be phantom pain in people who have amputations, right? So in some people, not everyone, but in some people with amputations, they feel excruciating pain in a limb that is no longer there. And if they have pain before they lose the limb, they're much more likely to have that kind of phantom pain than if they never had pain and lost the limb for a different reason. So the brain can perceive pain even when there's no possible way that it can be there because the limb itself is gone. So these are, don't worry about the specifics here, but this is just to show you that all parts of the brain, all different parts of the brain are involved in processing pain. And maybe the one that is most interesting to pull out is the amygdala. That's one of the boxes on the bottom. The amygdala is in charge of fear. So when we get worried about something or someone jumps up behind us, or we're on a dark street, it's our amygdala that gets super activated. So the amygdala is involved in the processing of pain, and that basically shows from a brain perspective what we just talked about, which is that when we perceive more threat, that would be our amygdala who's perceiving threat or fear, then the pain signal goes up. So this is a fascinating study, the first one here. So the ACC, that's the anterior cingulate cortex, is a part of the brain that was on the last slide involved in the processing of pain. And they did a study where they put people in a functional MRI machine, so when they do that, they can look and see how much activity is going on in different parts of the brain. So they looked at the activity in the anterior cingulate cortex, or ACC. And they didn't tell people in this study that they were trying to decrease their pain. That the subjects didn't know that. These were people in pain, but the subjects didn't know. They were just told that they were going to try to decrease activity in their anterior cingulate cortex, and when they did that, they were rewarded. So they were basically training them to decrease activity in their ACC, not telling them that it had anything to do with pain. And when the subjects did that, so when they were trained and learned to decrease activity in their ACC, in fact, their pain severity decreased as well. So even though they didn't know that they were trying to decrease their pain severity, by changing their brain, they decrease their pain. And there's quite a lot of evidence, actually, that catastrophizing, which is basically a worry and anxiety state of, oh no, it's going to get worse, these things are terrible, when people are in that state of catastrophizing, their pain increases. So this is a very interesting study, too, because we know that catastrophizing and pain go together, but we didn't know for a long time, well, which came first? So if you have a lot of pain, it would make sense maybe that you would catastrophize because pain is very unpleasant. But this is a study that used experimental pain. So they put a cream that burns on people's limbs, on their arm, I think is where they put it, or their hand. And they looked at their pain level and they looked at their catastrophizing level. And they did this every few minutes. And they looked to see which came first. Is it that people have a lot of pain and then they start to catastrophize because the pain is terrible, or do they catastrophize first? And what they found was that people who catastrophized first had increased pain. So it wasn't the pain that came first and then they catastrophized, it was the catastrophizing and then the pain got worse. And the catastrophizing is basically worry. Oh no, it's going to get worse, I'm not going to be able to stand it, terrible things are going to happen. And so that increases the threat perception of the brain and increases the perception of pain. So this is just validation that the catastrophizing really does increase pain, and the reason that that's so important is because we're going to talk in a few minutes about ways we can decrease our catastrophizing. So by doing so, we can help decrease pain. So the one really important thing to know about that's fairly new in pain science is called central sensitization. And central sensitization is something that the brain and nervous system does to try to help us, but actually it makes it harder for us when we have chronic pain. But here's the idea. when a certain part of the body has pain that goes on and on, the brain learns that part of the body is at risk. I'm worried about that part of the body. And so I'm going to turn up the sensitivity of my signal to that part of the body so I make sure that if something happens there, I won't miss it. So what it means is that when we have pain in a certain part of the body that goes on for a long time, particularly if it's associated with a feeling of threat, like this is bad or this is dangerous or this is very terrible, unpleasant pain, the brain actually becomes hypersensitive to any future stimuli from that part of the body. So it changes the perception. It distorts really or amplifies the perception of pain. And so sometimes even though the initial event is fixed, so maybe there was a fracture or a dislocation that then got fixed, the pain may still be there even if there's not currently a fracture that needs to be healed or a dislocation or subluxation. The pain may still be there because the brain has become hypersensitized to that part of the body. This was not known for a long time, and it's why way back when doctors sometimes felt that people with chronic pain syndrome were exaggerating because they couldn't find anything wrong, but still the people had pain. The fact is, this is true, you don't know this is true neurologic pain, and it's just that the brain has changed its sensitivity to that particular area. So this is really important because we can help fix this, and it's important to understand that this goes along with that feeling, that truth, that increased threat increases pain. So if we have central sensitization to a certain area and we have a feeling of threat about that area, it is much harder to manage that pain. If we can decrease the central sensitization and decrease the feeling of threat, then we have an easier time managing pain. So where does this come from? How does this work? It seems that it goes in both directions. So when you have central sensitization to an area, both the signal that's going up, meaning from the body to the brain, and the descending information that's coming from the brain to the body, both of those are abnormal, are functioning abnormally. And what happens over time, if you have central sensitization that goes on for a long time, you actually lose the ability to localize the pain. So maybe, for example, in the beginning it was the inside of your ankle that was in pain. Over time, the brain spreads out the sensitization. So maybe then it becomes the whole foot and ankle, both sides of the ankle, not just one side. And when you look at functional MRI, you actually can see kind of a blurring in the brain of where it's perceiving sensation from. But the good thing is that you can reverse that. So when central sensitization gets reversed, the signal gets turned back down to normal, the blurring in the brain changes back to normal. So all of these things are reversible and a really important part of managing the chronic part of the chronic pain syndrome. Remember, there's acute pain and chronic pain in EDS, but the chronic pain part, this is a really important part of managing that. So, what are some things that happen in terms of thinking when people have chronic pain or pain that goes on for a long time? Fear of pain or catastrophizing, as we said, increases pain. So sometimes we need to work on the fear of pain, but also the fear of movement. So kinesiophobia is the fear of movement. We start to worry, if I move, it's going to hurt again, and we change our body mechanics when that happens, and it increases our brain's sensation of threat. So we're basically kind of stuck and waiting for the pain to come back. All of that increases central sensitization, increases the sense of threat. So increases our pain amplification and then makes it harder to get back into regular life and get better. And the issue with kinesiophobia is that when you're afraid to move, you decrease your activity, of course. So when you do that, you get deconditioned, your muscle strength goes down, your aerobic capacity goes down, and your fatigue goes up. And your disability goes up. And this is important because some of the interventions we're going to talk about later specifically address this thing. But this is important, that a part of managing pain is managing this fear of movement, because the more we have it, the more we become deconditioned and fatigued and afraid of moving and have central sensitization, have increased threat. All of those things go together. Makes for more advanced chronic pain. But many of those things are manageable with the modalities we're going to talk about in a few minutes. So is EDS pain different than other kinds of pain? Because, of course, there are a lot of people who have various kinds of pain. This is a study. It was a smallish study, but it said some interesting things. It looked at 27 patients with EDS, and they looked at four things. They looked at thermal pain cessation threshold, which is when they put hot or cold on these folks, did they feel it sooner than a control population? They looked at how fast pain goes from 0 to a lot. That's a wind-up ratio. They looked at nerve conduction studies, so they're trying to see was there a clear neuropathy or nerve damage. And they looked at a fibromyalgia screening tool to see was there any overlap between EDS pain and fibromyalgia. And here's what they found. They did not find any nerve damage. So that looks at larger nerves. I know that there's small nerve neuropathy, but for the sort of general neuropathy that we talk about, they didn't find anything abnormal in any of the patients in their nerve conduction studies. They did find that there's some similarities between EDS and fibromyalgia. And in fibromyalgia, there also is this common event of having central sensitization, and basically the nerves are hypersensitive to pain. They found lower cold and heat pain thresholds in people with EDS, and they went faster from 0 pain to 100 pain, to high pain. Now, I do want to say one thing. A lot of people with chronic pain are tough. So people may say, well, I have a high pain tolerance, which often means I feel pain, but I keep going anyway because people with chronic pain are tough. So this doesn't go against that. This just says that people with EDS, and probably because they have long-term pain and have some central sensitization, are more likely to feel some of these pains sooner than some others do. So these are the kinds of tools that people can use for managing pain. Obviously, there are medications that we can use for pain. They have some issues, which we're not going to spend time with now, but I think are pretty well known. There are certainly procedures and injections that people use for pain. We're going to talk about acupuncture. We're going to talk about manual medicine, which is practiced by different kinds of practitioners, including chiropractors, osteopathic physicians, physical therapists, massage therapists. We're going to talk about mind-body techniques, which are extremely important in managing the central sensitization and the fear and feeling of threat that increases pain. We're going to talk a little about herbs and nutritional supplements, although I don't think they are as important as some of these other things in the management of pain. And then we'll talk a little bit about aromatherapy and how that might be used with the mind-body techniques. So before we get into specifics, I want to take a look at what are things that worsen pain, because obviously if these are things that worsen pain, if we can manage some of these, then pain can go down. So muscular tension absolutely worsens pain. So even if, for example, you have a neck that's a bit unstable, and some of that muscular tension is splinting your neck, so we want that. Still, if you're using a cell phone a lot, or you're sitting on the couch and using your laptop and you have a head forward neck posture, you're going to get the same kind of muscular tension in your shoulders that anybody else does, even people without EDS. So even though there are particular muscular tension issues in EDS, we also get all the same things that anybody else gets. So muscular tension increases pain. Anxiety and depression absolutely increases pain. So projecting the fear of the past pain onto the future, which is a component of anxiety, but more gets at what we talked about before in terms of kinesiophobia, fear of moving because of pain and threat. Sometimes people blame themselves or blame their body. So anybody with any kind of condition of the body that causes them trouble has a tendency sometimes to disconnect from the body, like my darn body is causing me all this problem and I'm just not even going to think about it and I hate it. And that stance actually of a sort of non-loving stance to the body actually increases pain. And so we're going to talk about some techniques that we might use to work on that. A life there that is focused on doctors and treatments and specialists and practitioners is not so good for pain also because it increases that sense of threat and that disconnection from sort of you as a human being and focuses on the treatment part. So I know that all of that has to happen, absolutely, but it's really important to find other parts of you that don't have to do with doctors and treatments and such. That's very important. Sleep is extraordinarily important for managing pain. So poor sleep makes pain management harder. And I know it can be hard to sleep sometimes for multiple reasons, autonomic reasons and also pain reasons, but working on the sleep is very important in terms of managing pain, and we'll talk about some things that can do that without pharmacology. Systemic inflammation can increase pain, and that can be made worse by poor sleep, by stress, by the standard American diet. So there are kind of inflammatory foods, which are things like sugar and flour, white flour, white foods in general. The anti-inflammation foods tend to be foods with very few ingredients, real food, brown foods, colored, multicolored vegetables and fruits. And then, of course, central sensitization we talked about before. So part of what we're going to talk about in terms of integrative approaches is managing many of these things, because as these go down, pain becomes easier to control. All right, we're going to start with some talk about mind-body medicine. So the mind and body are connected, absolutely. And so worry is a sort of negative mind-body technique where we imagine terrible things that could happen and our body responds, right? So when we activate our stress response, all kinds of physiologic things happen. Our muscle tension goes up, our blood pressure goes up, our pulse goes up, our respirations change, our hormones change, our autonomic nervous system gets messed up. So the stress response, it's easy for us to activate that. The relaxation response is the opposite of that. So mind-body techniques are mostly engaged in decreasing the stress response and activating the relaxation response. And there's a million ways you can do it. Here's a list of some things: meditation, guided imagery, biofeedback, hypnosis and self-hypnosis, diaphragmatic breathing, which is a form of relaxation breathing, prayer, yoga. I do understand there's issues with yoga and EDS, but for very gentle yoga, sometimes people can find a benefit from a mind-body perspective, Tai Chi, Qigong, and there are many others. So if you're taking a hot bath and your whole attention is in the bath and you're thinking about what it feels like and what it smells like and what the heat is like, and you're 100% present in your experience of taking a bath, that's a mind-body technique. If you're in the bath but you're thinking about all the million things that you have to do or what your sister said to you yesterday, then that's not a mind-body technique. So it's anything that stimulates the relaxation response. These are some typical ones, but there certainly are others. Some people use music, art, hiking in the woods, etc. So I want to tell you about MBSR, which is mindfulness-based stress reduction, just in case it's of interest to you to pursue training. There are a million ways to do mind-body interventions, and we'll talk about a few in a second, but this is kind of a standardized one, a class that you can go to in whatever town you live. You can probably Google MBSR and your town or a big town near where you live, and you're likely to find a class. So these are common and all around the U.S. at least. I'm not sure about internationally. And it's an 8-week group class that teaches you all kinds of different skills in mind-body medicine. You do weekly time with the class and then a 7-hour retreat, and they expect home practice, though. They expect 40 to 45 minutes of home practice of meditation. So it's a pretty intensive program. You don't have to do this. There's plenty of other ways to do things on your own, which I'll show you in a sec. But if you really want an intensive experience in learning relaxation techniques, this is a sort of standardized, neat way to do it. And there's lots and lots of evidence, this is just a few examples, that using MBSR and doing the home practice of meditation gives a lot of beneficial outcomes, like increasing pain tolerance, lowering pain and pain distress, lowering emotional distress, improving sleep, and a bazillion other related things, improving quality of life, decreasing anxiety, decreasing depression. So if people actually do this, they actually meditate at 40 to 45 minutes a day, tremendous changes can happen in pain, anxiety, and depression, and increases in quality of life. So if you're really motivated to do it, this is a terrific thing to do. On the other hand, you don't have to do it this much. If that doesn't work for you, that's like saying, it'd be great if everybody exercised for 45 minutes 6 days a week, but that doesn't mean that you shouldn't exercise 20 minutes 3 times a week if that's what fits better into your life. That's great too. So this is the same sort of thing. MBSR is the Rolls Royce, but there's plenty of other ways to put mind-body medicine into your life that are also beneficial. And perhaps one of the easiest things to do is called guided imagery. Guided imagery is basically using your imagination to generate mental images that bring you to a state of relaxation or positive physiologic change. So anxiety can be thought of as negative guided imagery, so you're imagining terrible things. Positive guided imagery is imagining relaxation states or positive states of physiologic being that you're looking for. So based on the kinds of images that are used in the guided imagery, it can be about seeing yourself in a peaceful place. Sometimes for pain imagery, they'll imagine the place of pain starting as a fiery red color, and over time they'll lead you to a blue-purple color, which is a sort of less intense sensation. Sometimes they'll take a space in the body that's in pain and wrap it in bubble wrap so that it's no longer as present, or they'll take it and put it up on a shelf. So when you're doing guided imagery, it's really simple for you because you're just getting either a CD or a download or whatever and putting your earbuds in and just listening. So I would highly, highly recommend that everybody consider trying this out. I gave you a website that has resources that has nothing to do with me. It just happens to be a website that has a lot of really high-quality stuff, a lot of high-quality guided imagery, and they have them targeted to specific things. So there's ones for sleep, ones for pain, ones for anxiety or depression, or if you're going to have surgery, or if you have cancer and you're going to get chemotherapy. So they have targeted images for different conditions, which I think is particularly beneficial. They have them for stopping smoking and a million other things. So consider, they generally run like $12 to $15. Consider taking a look there. You can sample, listen to some of them, and see if you like the voice and it sounds right to you. But this is something really all of us should put into our life because generating the relaxation response is beneficial for a whole lot of things, including pain, but also general well-being. And it's very beneficial for sleep. So if you're having trouble sleeping, putting guided imagery into your routine where you listen for 20 to 30 minutes right before you go to sleep can be a very important intervention that can completely turn around some people's sleep issues. This was a study that looked at guided imagery for fibromyalgia. I couldn't find a study that looked at guided imagery for EDS, although I hope that someday we'll do one at my center. But since there was overlap between fibromyalgia and EDS, I thought this was still relevant to us. And what they found was people listened to the guided imagery every day for 6 weeks, and they compared that group to a usual care group who just did whatever they were doing before from a medical perspective. And in the people who did the guided imagery, the fibromyalgia impact scores decreased significantly, so that's the standard measure for how bad is your fibromyalgia, and their self-efficacy for managing pain and other symptoms of fibromyalgia improved. It's also used for headaches. This was done in a specialty headache center, so all of these people had probably already been through the regular doctors and ended up in the specialty center. And there, too, they looked at individualized therapy plus guided imagery versus just the individualized therapy alone, and they did it every day for a month. And the people who did the guided imagery had their headache disability scores decrease. Okay. So now let's just talk about relaxation breathing. When we are stressed, which most of us are all the time because that's just life, we breathe into our chest. Breathing lower into the belly or into the diaphragm, called diaphragmatic breathing, is a relaxation breathing technique. And when you do it, it actually stimulates the vagus nerve and stimulates the parasympathetic nervous system, stimulates the feeling of relaxation. Now, sometimes in the beginning, it can be hard to do because we're so used to tightening up our belly and breathing into our chest. So I highly recommend that you try this, but don't get concerned if in the beginning it seems hard. It's fine if it's hard. Just keep trying, and then it gets easier and easier. So one way that you might do it is to lay down on your bed or wherever you're comfortable, put one hand on your chest and one hand on your lower belly, and just try to breathe a little deeper and lower than you normally do, and see if you can feel some pressure on your lower hand so that your lower belly is pushing out against your hand a bit. And just do it for, 15 breaths in the beginning and then drop it and try it again later. And what you'll find is all of a sudden at one point it will sort of click and it will become easy to breathe down deep into your belly. And once you have that skill, once you get it, you don't lose it. And it's a technique that you can use any time. So if you don't want to do a whole guided imagery, for example, as you're going to sleep, you could just do 10 diaphragmatic breaths, for example. Or if you find yourself getting agitated by something, you could do it then. Or you could do it every day before your evening meal, or when you first get in the car on the way to work. So putting this simple 5 or 10 diaphragmatic breaths into your day a few times is a way that you can generate the relaxation response any time. It's easy, it's quick, it works, and it's an important skill to have in your wellness toolbox. Okay. So what is meditation? Meditation is a word that freaks out some people, not everybody, but some people, and if it does, don't worry about it. It doesn't mean you belong to any religion of any kind. It doesn't mean you even have to sit on the floor, like, with your legs crossed and your hands on your knees. It doesn't mean any of that. It doesn't mean you have to go to a special place. Basically, meditation just means focused attention. And when you meditate, you focus your attention on something. And when your attention wanders, which it always does, and that's fine, you just gently and non-judgmentally bring your attention back to your area of focus. So some people will say, oh, I tried meditating, I can't do it, I'm always thinking about stuff. And that's actually normal. That's what you're supposed to do. Your brain and mind are supposed to think. We like that. It's fine. And it's actually the act of learning to notice a thought and then leave it there and bring your attention back to your breath or your steps or your sound, whatever it is that you're concentrating on. It's that practice of noticing your thought, leaving it alone, and bringing your attention back to your area of focus, doing it over and over and over. That's actually part of what brings upon us the benefits of meditation, because it teaches us that you can have a thought but not get carried away by it. So what does that mean to have focused attention? So you can use your breath. That's generally called mindfulness meditation. Personally, I like that because it's always with you and it's easy. But there's plenty of other things that you can use as your attention thing. You can use your steps. So some people don't like to sit still so much, and they would rather do a walking meditation. And in a walking meditation, you're focusing your attention on your steps. So as you're walking, you're noticing, what does it sound like? What does it feel like? As you're putting your right foot and your left foot and your right foot and your left foot in, all your attention is going to the sound and the feeling of your steps. And if your attention gets pulled away, like, oh, I have to go to the store on the way home from work, you just notice that and then just bring your attention back to your steps over and over and over. So some people might do a walking meditation on the way to the car after work, or maybe the first block as you're walking your dog, or if you take a walk for exercise, the first block or two of your exercise walk. So it's a wonderful technique to have in mind, because if you feel like, well, I don't have time to sit in meditation, often we're walking somewhere. Even if you just did 10 steps, that's still great. That's 10 steps of stimulating the relaxation response and focused attention, and that's great. Some people use a sound. I tend to call that a mantra meditation, like Om or other sounds. In transcendental meditation, you're given a mantra when you do your training, but you certainly don't have to do that. You can just use your breath or any word or sound that works for you. Some people like to use a phrase on the inhale and exhale, like peace when they breathe in and love when they breathe out. You would just think it to yourself, or all is well, or whatever works for you. God is love. Whatever works for you that feels like a healing phrase, you could do one on the in-breath and one on the out-breath. And again, if your attention gets pulled away, which it will, you just bring your attention back to your phrase or word or breath. So here's the world's easiest meditation, and if you don't like the word meditation, you can just call it the world's easiest relaxation breathing that stimulates the relaxation response. And this is something any of us can do, and I highly recommend that you try it out. The concept is this: when you breathe in, you think one, and when you breathe out, you think breathe. You breathe in, you think two, breathe out, you think breathe. And just do that for 10 breaths. And you would be amazed in just 10 breaths how you can feel a difference in your physiology, how you can feel yourself stimulating the relaxation response. And if your attention wanders, no problem, just bring your attention back to your breathing and your counting. So really, we should all have this one in our back pocket because it's so easy. And this is another thing that you can do right before you go to sleep, particularly if you have issues with sleep, but even if you don't. Doing 10 breaths like this as you lay in bed, or 10 breaths like this when you first wake up, just to sort of get yourself set for the day, can be really important interventions. And all of these, you might imagine, when we stimulate the relaxation response, that's the opposite of the stress response. That decreases threat. So that whole thing we talked about in the beginning about how increased threat increases our perception of pain and increases central sensitization and sort of turns up the sensitivity of our pain nerves to our brain and our nervous system, this does the opposite of that. So these kinds of mind-body interventions are treatments for the threat and central sensitization. So this is an interesting study that looked at mindfulness meditation and pain sensitivity. And the reason I thought this was so interesting is that they only had people practice for 3 days. So you might think, well, look, I'm never going to be like 40-minute-a-day kind of meditator. I can't commit to that. But these people only did 20 minutes a day for 3 days. So it's not like they were experienced meditators. And they used, again, experimental pain with electric shock. And they looked at people before and after their intervention. And after they taught them just 3 days of mindfulness meditation, they had decreased pain sensitivity. So they were able to tolerate a lot more pain than without the training. And what they think is that the effect seemed to be related to people's anxiety, which they decreased because meditation is a wonderful treatment for anxiety, and the increased ability to focus on the present moment. Because what we sometimes do when we have any pain is we're not only feeling the pain in the moment, but we're going, well, what if it gets worse? And what if it's not better by the time I'm supposed to go on my trip? And, what if I fall? And so we generate worry into the future that escalates our feeling of threat and escalates our pain. And meditation teaches us to be in the moment and not get carried away by our thoughts. So even with just a 3-day trial of mindfulness meditation, people could decrease their pain sensitivity. Here's a reasonably small study that looked at chronic low back pain. Chronic low back pain is a particularly difficult kind of pain to treat. And they took folks who had chronic low back pain and gave them an 8-week mindfulness meditation group. And they had increased improvements in their pain acceptance, their engagement in activities, and their physical functioning, all of which are very important. Now, we talked before about kinesiophobia, which is the fear of movement that can be related to pain. And moving meditations can give you a double bang for your buck. So things like Tai Chi and Qigong, which are very similar, can be very helpful for a couple of things. Number one, they stimulate the relaxation response. So they're basically a meditation, but in movement. But they also allow you to use your body in a really slow, safe, controlled kind of way that can decrease kinesiophobia or fear of movement, can get people back into their body and feeling good about their body and what they're able to do. And also, people with EDS have some issues of knowing proprioceptions or knowing where their joints are. And Tai Chi is very good for grounding people into the earth, sort of knowing where their body is, knowing where their legs are, getting strength in their legs, grounding into the earth. And so it helps balance. It's actually used now in the elderly because it was found to decrease falls in the elderly for this very same reason. So I think Tai Chi and Qigong can be particularly beneficial for people who have chronic pain that leads or is related to kinesiophobia and stress and fear of pain. This is a study published in the New England Journal of Medicine, which is obviously a very well-known journal, that looked at Tai Chi for fibromyalgia. And again, the fibromyalgia impact questionnaire is a standard questionnaire that looks at severity of fibromyalgia. And people who did Tai Chi 2 times a week for 12 weeks decreased their FIQ scores significantly compared to control. So they had a bunch of people doing the Tai Chi and a bunch of people not doing the Tai Chi, and the people who did the Tai Chi significantly decreased their FIQ scores. And they maintained their improvements after 24 weeks, which was also important, and probably particularly important, there were no adverse events. So nothing bad happened. It's very inexpensive, and it decreases pain. Okay. So the next concept, that's meditation we were talking about, and including moving meditations. But there's also a concept of mindfulness. Some people say mindfulness meditation, which is a kind of meditation that focuses on your breath. But there's also a concept of mindfulness, which is different from meditation. The concept of mindfulness is being in the present moment in which you are currently in. So often we spend time not in the present moment. So we are either ruminating about something that happened in the past, which is sort of depressive thinking, or we're worrying about something that could happen in the future, which is anxious thinking. But often, not always, but often in the moment, it's not that terrible. Or at least it is what it is, but we don't need to make it more terrible by being in the future of all the even worse terrible things that could happen. So the practice of noticing when you're not in the present moment and bringing your attention back to the present moment when you notice that, perhaps with a breath. So if you notice you're going, oh my gosh, what if this isn't better next week and I'm supposed to go away, and what if it's not better by the time I start the new job? So that's all in the future. That's not right now. And take a breath. And bring yourself back to the present moment. Like right now, I am having some pain, but, I'm with my friend and I'm doing okay and we're going to have dinner and my dog is here with me. And so focusing on the present moment in which you're living is extraordinarily important for managing the feeling of threat and anxiety. So meditation can help you do that, but you can also have this perspective even if you don't meditate. So here are some of our teachers for living in the present moment. That dog, right? That dog is going, oh my goodness, what on earth is that falling from the sky? That is so incredible. I'm going to guess he's probably not thinking, what if they forget to feed me tonight? Right? So when in doubt, think about the dog and what they think when they see something neat, like snow falling from the sky. That's how we want to live as much of our life as we can, the present moment and then the next present moment and the next present moment. And obviously, we're all going to be in the past and the future sometimes, but at least if we see that as a value that we try to notice when we're in the past or the future and bring our attention back to the present, that can be tremendously valuable. Okay, that whole thing we just talked about was mind-body medicine. So now let's talk about acupuncture. So I'm going to tell you first about the Chinese perspective of acupuncture because it's been around for thousands of years, and I can't imagine talking about acupuncture without giving some homage to the history of acupuncture. But then in a second, we're going to talk about what the Western view of acupuncture might be. But from the Chinese perspective, we are all we have opposing forces, yin and yang forces, and when we are in balance, we have health. When we have imbalance, we have disease. And we have pathways that they call meridians through which energy flows that they call qi. And the Chinese perspective of acupuncture is that when the qi gets blocked up at certain points in the meridians, that causes imbalance and disease, and that putting needles in those particular points can get the qi flowing again and get us back into balance and help unblock us so that our disease gets better. So that is a very comfortable idea for some people and an uncomfortable idea for other people. So here are some other theories of acupuncture. I will tell you, nobody knows for certain because we can't measure these meridians. We don't see them. We can't measure qi. We don't know what that is. But there are some other theories that have come out of some of the research around acupuncture. One of them is called a gate control theory, that acupuncture can stimulate some of the inhibitory nerves. So we have nerves that increase pain, and then we have nerves that decrease pain. So the gate control theory suggests that acupuncture may stimulate the inhibitory nerves so that the signal, not as much of the signal gets to the brain to feel pain. There's an endorphin model because there is some evidence that when you get, when you get acupuncture, endorphins and our endogenous endorphins are released. And then there's a neurotransmitter model that acupuncture can affect how much serotonin, norepinephrine, and other neurotransmitters are released. But what we do know is that there's quite a bit of evidence in support of acupuncture. And this was just a summary from the Mayo Clinic proceedings that when we look at all of the well-done research, because there's a lot of research, some of it well done, some of it not so well done, but when we look at the really well-done research, these are the things that acupuncture tends to be the most helpful for: migraine headaches and tension headaches, osteoarthritis of the knee, fibromyalgia, which I think is important because we know there's some crossover, back and neck pain, and postoperative pain. And the one thing that didn't show up in this particular review, but there's a lot of evidence for acupuncture for nausea as well. nausea with pregnancy, with chemotherapy, from medications. So all of these things, plus nausea, are places that you might think about trying acupuncture. Chiropractic, which I know is controversial in EDS, and so this I want to make absolutely clear that what I have here is just a personal communication from a chiropractor who teaches for me, who happens to be the smartest chiropractor that I've ever met, who I really trust. So this is not a study. This is just something that I wanted to share with you in case you are ever thinking about chiropractic. Some people will say, if you have EDS, don't ever go to a chiropractor, but I know that some people do it anyway. So I wanted to share this because I think this is important. His suggestion, Dr. Morrison's suggestion, of the modifications you would make in EDS is to, for standard chiropractic anyway, avoid the cervical region, the upper neck region. He recommends doing exercises focused on large joint centration, which means exercising with the joint in the absolute optimal position, and working on pelvic control muscles and deep neck flexor muscles, because those are part of what keep the neck stable. This next one I think is important, which is movements that don't hurt, because if what we're trying to do is tell the brain we want to turn down the central sensitization, we want to decrease the sense of threat, we want to make sure that anything that you're doing doesn't do the opposite of that and tell the brain, oh, be careful, be careful, be careful, we're worried, there's threat here, be careful, because that will do the opposite of what we're looking for. So if somebody tries to do a chiropractic movement that hurts, absolutely, I would say don't do that, even if it's not one of your particularly unstable joints, just because we want to teach your brain and body to be de-threatened by movement. Gentle soft tissue manipulation, and then pain education of the kind that we just talked about, that decreasing threat is tremendously important for managing pain. So I would definitely have cautions with just sort of your standard chiropractor who doesn't know a lot about EDS, but if you have a chiropractor who does manual medicine, you might consider these sorts of interventions that are low velocity, more about education and subtle exercise sort of movements. Now, massage, I know, also has some controversy in EDS, but with massage, I think it's important to think about the fact that, on the one hand, if you have EDS in a particularly unstable joint, you may have really tight muscles around it that are splinting, that are trying to keep it safe, and you don't want to loosen those. But that doesn't mean that every single tight muscle in your body is doing that very thing. So working with a massage therapist who is a medically trained massage therapist, meaning not just like the person at the Red Door Spa who's doing a head-to-toe massage, but someone who really uses their hands diagnostically and is used to doing massage that way would be important. And somebody that knows you and knows your body and would know, for example, oh, we always stay away from that shoulder, but, you know, you're up here and your upper neck on the other side is really tight, and when it gets really tight, it gives you headaches, and so let me work on some of those tight muscles and trigger points. So don't feel like all massage is off limits all the time, because the relaxation benefit from massage is also something to consider. So people can do really gentle massage that isn't going to relax muscles but does relax the whole person. Or you can do, for instance, if your feet don't cause you a problem, you could do a more significant massage in your hands and feet if those aren't the places that bother you. So we just want to be conscious in massage. You don't want to loosen up muscles that are protecting unstable joints, but not every joint is unstable, and if you have tight muscles in other places that are causing you pain and symptoms, massage might actually help those. Trigger points. Myofascial trigger points are something that happens to everybody, but happens particularly to people with EDS. And they are basically hyper-irritable regions of the skeletal muscle, and you can feel them. They feel sort of crunchy and hard when you push on them, and they really hurt. Now, again, you don't want to release them around a joint that is being splinted and protected, but for other parts of the body that are not currently protecting a joint but are just overly tense because of stress or carrying a heavy purse or, you know, body mechanics or having a head forward position from working on your computer on the couch, those things can benefit, you probably want to work with your physical therapist or manual medicine person to know which trigger points you want to work on. But once you know for yourself, these are the trigger points that tend to rile me up and give me symptoms, but they're not protecting a joint, then you can work on these yourself. And this big S thing is something that you can get on the internet that helps people if there's trigger points in your back that would be hard to reach yourself. You put one of those ends on your back and then you push it forward from the front and you can actually massage a trigger point on your back with this thing all by yourself. Okay, we're going to talk very briefly about herbs and supplements. I don't think these are the major thing for managing pain. I did want to bring up glucosamine and chondroitin because a lot of people ask about this. If you have EDS, you are eventually more likely to get arthritis, and a lot of people use glucosamine and chondroitin for arthritis. They use it in veterinary medicine, actually, for arthritis too. There is conflicting evidence, but overall, I actually think it probably does work. There are a lot of small studies that show effectiveness, including the same effectiveness as some medications that have been standardly used by rheumatologists and other physicians like Celebrex and others. There's a study that showed a decrease joint space loss, so that's not just placebo, that's actually something they could measure. But there was a big meta-analysis in the British Medical Journal that showed no effect. So the people who are very pro-glucosamine chondroitin have all kinds of reasons why that was not a good study, and they left out some of the positive studies. So I think there is controversy about whether it's helpful, but what has been pretty clear is that it's safe. And some people find it tremendously helpful and it's safe, so if you have arthritis and you want to try it, it's probably fine to do so. After you've talked to your doctor, of course. Other supplements that people could consider, SAMe is sometimes used also in osteoarthritis. OA is osteoarthritis. And it's also helpful for depression, so it's a medicine that if you're having some osteoarthritis pain and you're feeling a little depressed, but you don't want to take pharmaceutical antidepressant, this would be something that you might consider. And then for belly pain that may be IBS-related, probiotics can be very important. The one thing I want to say about probiotics is that probiotics, the good ones that really work, are kind of on the pricey side. If you're getting a huge bottle and it's on the counter at Walmart, it's probably not worth spending your money on because the probiotics have to actually be alive. So the ones that are beneficial are stored in the refrigerator. So they should be stored in the refrigerator in the store, and then you have to store them in the refrigerator when you get home. Otherwise, it's probably not worth spending your money on them. Another thing to consider is capsaicin. Now, capsaicin has some evidence for osteoarthritis pain, but it's actually used in all different kinds of pains. It used to be prescription. Now it's over the counter, and it's made from hot peppers. It's a cream that you use. It's made from hot peppers, and it basically fills up substance P and confuses your pain nerves so that you don't perceive pain as much. Two things you have to know about capsaicin. Well, the first is that it's very safe, but the other things that you have to know are, one, in order for it to work, you have to use it 3 to 4 times a day for several days. So it's not like you can just take a Tylenol and you feel better. You can't just rub it on one time and feel better. It takes a few days to basically fill up those pain nerves so that it will start to work. So you have to have a kind of commitment to use it. And the other thing to know is that when you use it, when you first put it on, it will burn. It doesn't hurt you. That shows it's working, but it does freak some people out in the beginning. And particularly if you have central sensitization, you definitely want to tell yourself in your brain, really tell yourself, this is going to burn, but it's fine. It's not really burning my skin. It's safe. This is helpful. And when you turn down your threat level like that, it can be very helpful, and people actually sometimes even like the burning feeling because it shows them that something is happening. But if you didn't talk to your brain first and just threw it on a part of your brain that you're worried about, you might actually feel higher pain because it would be a strong sensation with a feeling of threat and central sensitization. So it can be very, very helpful, but just be aware it's going to burn, and that's okay, and that you have to use it a few times a day for a couple of days in order for it to start working. Okay, aromatherapy. So aromatherapy can be very beneficial, but you have to use real essential oils, so you can't use the fake perfumey kind of ones, but if you go online and just type essential oils, you'll have a zillion different options. Some people feel that it really, really matters what oil you use for particular conditions. Other people feel like the one that you perceive that feels good to you, that you feel relaxes you, is the one that you should use. So I gave you a list of some essential oils that are often used for pain, but that doesn't mean you couldn't use other things, other scents that particularly work for you. And what a lot of people do is will sort of tie it to a relaxation activity. So if, for instance, you got essential oils and you got a guided imagery CD and you use them both together, then later on, when you use the essential oil, you may instantly cause your body to relax because you've connected the two things, the strong scent and the sense of relaxation. So that's something that you might really want to consider doing. Get some essential oils, start using it with a guided imagery so that you have access to that feeling anytime you use the oils in the future. And this is another thing that can help with sleep. And so how do you do it? There's a million different ways. You can just put it on a cotton ball and hold it under your nose. You can put some on your pillowcase. Some people take a bunch of cotton balls, put the oil on it, and then put it in a Tupperware and keep it at their desk or somewhere that they spend time, and then that will last for weeks and weeks. So every time you open the Tupperware, you'll have access to the scent, but when you close it up again, it stays in there so that it doesn't dry out. There are necklaces that you can wear that use essential oils. There's a million different ways that you can access these. The simplest is probably the cotton ball. I'm going to imagine that a lot of people are already using TENS and EMS. That's a muscle stimulator, but I'm going to talk a little bit about them. TENS is transcutaneous electrical stimulation, and it uses a low voltage electrical stimulation for the management of pain by basically messing around with the normal pain signals and confusing the brain in a sense. Some people think that it also leads to release of endorphins. So you'll often get this from a physical therapist. There are TENS units that you'll use at physical therapy, but also your doctor, under the advice of physical therapist, can prescribe you one, and you can buy one and have it at home. Sometimes insurance will pay for that, sometimes not. People also use electrical muscle stimulation, which looks basically the same and feels very, very similar. The only difference is that this one, instead of just confusing the nerves, basically, it elicits an actual muscle contraction, so you'll feel your muscle contract. This I would definitely use only under the guidance of a physical therapist, but again, you can have these, you can get a prescription, have them at home. Sometimes if you have a really tight muscle that's not one that's protecting an unstable joint, so you want to relax it, it will contract the muscle so many times, so maybe you leave it on for 20 minutes, that it fatigues the muscle and then the muscle relaxes. So if massage isn't getting it to relax or trigger point massage isn't getting it to relax, sometimes using the electrical muscle stimulation can get it to relax. So let's just talk for a second about cognitive behavioral strategies around pain control. So we tend, all of us, to have negative cognitions or negative thoughts about all kinds of things, certainly about pain, but also about a lot of other things. Examples might be, I'll have this pain forever, things will never be the same, I'm never going to live a happy life. And all of these kinds of negative cognitions have been shown to increase pain. So we want to do everything that we can to decrease our brain's sensation of threat and pain. And so addressing these negative cognitions is one way that has been shown beneficial in the management of pain. And so you can work on this yourself. You can get a book on cognitive behavioral therapy, but probably the best way is to actually see someone who does cognitive behavioral therapy who can teach you ways to dispute these negative cognitions or negative thoughts. So the one thing I want to say is that when we say someone has had therapy, meaning psychological therapy, there's all different kinds of therapy. So if it's just supportive therapy, meaning, oh gosh, that sounds like it was really hard for you, tell me what happened next, wow, that must have been really difficult, that's wonderful in certain circumstances, but that's not the kind of therapy that's been shown to decrease anxiety, depression, and pain. Cognitive behavioral therapy specifically has been shown to decrease anxiety, depression, and pain. So if you're going to see a therapist and you want to work on some of those issues, particularly pain, you want to make sure to ask them, do you do cognitive behavioral therapy? Because some do and some don't. And you definitely want to go see somebody who has training in cognitive behavioral therapy, also called CBT. So we all have this kind of monkey mind, right, that's spinning thoughts in our head all the time. Oh, my God, this is going to work. That's not going to work. I have to do this. I have to do that. So managing that monkey mind is one of the things that meditation helps us do, and cognitive behavioral therapy helps us do, but we can also just start to notice it ourselves. So if you're spinning, and this is another way to think about catastrophizing, oh no, what if this happens, what if that happens, oh my gosh, what if it gets worse, that we practice a couple different options. One of them, particularly helpful for if you're having trouble sleeping, is called a dumping journal. So you keep a journal by the side of your bed, and if you're laying in bed sort of spinning various thoughts, you just write with no attention to grammar or spelling or punctuation or anything. You just write as fast as you can all the junk that's in your head, basically allowing your brain to say, see, I put all that important stuff into this journal. You can let it go now because it's right here. That can sometimes be very helpful for people trying to go to sleep. But other ways to manage this monkey mind, distraction of various kinds, exercise is great. And exercise, by the way, has been shown to be as effective as antidepressants for depression. It helps pain as well. Meditation can help, moving meditation, guided imagery, a lot of the things that we talked about before. Sleep, because sleep deprivation exacerbates pain. So that is really important to remember. Sleep deprivation exacerbates pain. So we have to do everything we can to manage our sleep. And a lot of the things we talked about before, including diaphragmatic breathing, the counting meditation, a sitting meditation, a walking meditation, guided imagery, Tai Chi or Qigong, all of those things have shown benefit in sleep. And as I said before, exercise of any kind, which doesn't mean it has to be gym exercise, just movement of any kind of whatever you're able to do is really beneficial in managing pain and managing mood. Connections are super important. So people who have decreased connections have a harder time managing pain. But we have to think about different people are different. So extroverts need a lot of connections. Introverts might only need one or two. So it's not about number. It's about feeling that you have some connection to others. And it doesn't have to be people. Absolutely, animal connections are hugely important. And for some people, that's the kind of connection that works the best for them. And it may just be micro connections. So it doesn't mean that you have to go out. You might just send a text to somebody in your life who may not even live where you live and just say, I just want you to know I was thinking about you. There's a lot of evidence around gratitude and the benefits of gratitude, particularly a gratitude ritual, meaning every day you do some sort of work around gratitude. And people who do that have increased happiness level, decreased depression, increased quality of life, increased satisfaction with their life. What I do, which is a way that I get sort of a 2-for-1, I get gratitude and connection. I have a friend that I've known since I was in high school, and every evening or so we send each other a list of 5 things we're grateful for in the day. And we don't have a conversation about them, we just type them out and send them. So that's a way to have kind of a micro connection and to do a gratitude ritual. The important thing about doing a gratitude ritual is it has to be different every day. So you can't just say, oh, I'm grateful for my family and my friends, because of course you are, and that doesn't change your behavior in any way because you just kind of get used to thinking that and saying that. The important thing when you're doing a gratitude ritual is that there's some regularity, ideally every day, but at least maybe a couple times a week or minimum once a week, but that also it be different every day. So you might say, I'm grateful for that new restaurant that I found, for that great parking place that I got, and for the great meal that I had at lunch. Or the next day you might say, I'm grateful for the movie I went to with my daughter. I'm grateful that my kids were getting along today. I'm grateful that my dog's diarrhea is better. Okay? So this says a couple things. Number one, of course, it focuses on a positive thing the moment that you're doing it, but it also trains your brain to find positive things even when you may not be thinking exactly about positive things. So it's like building a muscle to look for things to be grateful for. And on a really bad day, it can be hard to think of things to be grateful for, and that's even better. You get more benefit by doing it when it's hard because it becomes a skill that you grow. Nurturing your spiritual side is really important for managing mood and threat and pain. And so that just means whatever is really meaningful to you. So for some people that's religion, but certainly not everybody. For some people it's animals or nature or love or family or art or music. Doesn't matter what it is, but make sure that there's some of it in your life, whatever that thing is that is really meaningful for you. And if you have no idea what that is, that would be your first homework, is to try to get a sense of what does really matter deeply to you, and make sure you have some of that in your life. Here's something that is related to gratitude, but is a little bit different and is really important. And it's called positive reframing, or being a benefit finder. So in any circumstance, we can think about all the terrible things about a situation, or we could think about positive things about the situation. And if we think about positive things about the situation, it doesn't mean we like it. So, for example, you could practice being a benefit finder even if someone really important to you just died. Certainly doesn't mean that you wanted them to die, or that you're happy that they died, or that it's not the worst thing ever that they died. It is. But you might also say, well, how could I be a benefit finder about this? Well, I realize I'm stronger than I thought I was because I didn't think I could survive this. And I do see how many people love and support me because people have come out of the woodwork. And I did meet that new lady at the support group, and I think she might really turn into a friend. So none of that says you like it, but it is different than focusing only on the negative parts. And learning this practicing this behavior of, even in a difficult situation, being able to pull out some positive things that have come from it is tremendously beneficial, decreases anxiety, decreases depression, decreases threat, and by decreasing threat can help manage pain. Related a little bit, but probably worth pulling out separately, is the practice of asking positive questions. So we may ask negative questions like, oh my God, why do terrible things always happen to me? Or we can intentionally ask some positive questions like, well, I hate this, but how can I use this experience? Or what can I learn? Or has anything surprised me in a positive way, even though, this is really tough, but is there anything positive that's come out of it? Or do I have a new perspective or a new strength or something? And if you can't even get to that, you can always ask, I wonder what this experience will mean for me. And even if you can't answer it right now, just making space for that question, I wonder what this will mean for me, kind of opens the possibility that you might find meaning in this difficult experience. And one of the things that helps us cope with difficult experiences is being able to find meaning. So in a really tough time where you can't even get to a positive question, I would encourage you to think about just putting out there, I wonder what this will mean for me. So there's evidence that positively ruminating on the things that have happened in your day, ruminating on the good things that have happened in your day, actually improves mood, decreases anxiety, and decreases sense of threat. So we tend not to do this. We're pretty good at ruminating on the bad things that happen, but ruminating on the good things that happen is a skill that we should develop on purpose. And we can put it together maybe with a gratitude ritual. So some people do a gratitude ritual where they just lay in bed. This is what I was doing myself before I started doing this thing with my friend, is I would just lay in bed and call to mind 3 things for which I'm grateful. So you could lay in bed, do 10 breaths with your diaphragmatic breathing, or count your 10 breaths, do 3 things that you're grateful for, and then ruminate for a minute or 2 about something positive that happened in the day. That would take you all of probably 2 minutes, which even the busiest of us has, and is a way that you can start generating more positive mood and optimism and decreasing threat, which helps decrease pain and increases mood. So a couple things just to think about are trying to be curious about your body sensations instead of right away going to my stupid body, right? So, gosh, I was doing better. I wonder why now my neck is hurting more. I wonder, well, I did, spend a lot of time on the couch in that bad position, and I did stay in a hotel that had a different pillow. So just try and use curiosity to learn yourself rather than, or at least as a counterbalance to always being upset or angry at your body. Crucial to remember that threat worsens pain. And so you want to decrease the threat that you give yourself as much as possible. And if doctors try to give you a sense of threat, which we sometimes are good at, reject it. You know? You don't always, if they say, gosh, that MRI looks terrible, then you might say, yeah, but I bet there are people with MRIs that look bad but still do fine. So let me tell you very briefly about a really important study that happened that was published in the New England Journal of Medicine. This is a study that looked at back pain. It wasn't EDS, but you'll see in a second why I'm sharing this with you. It looked at back pain and MRIs, and it took a whole bunch of people, half of whom had back pain and half of whom did not have back pain, and they MRI'd everybody's back. And they were looking at discs and whether ruptured discs were associated with back pain. Because we always say, oh, you come to me with back pain, I do an MRI, you have a ruptured disc. I say, well, no wonder you have back pain. Look at your disc. It looks terrible. But the fact is, and this was crazy and it blew everybody's mind, there was no correlation between who had back pain and who had a ruptured disc, which means some of the people with back pain had normal discs. Some of the people without back pain had ruptured discs. There was not a correlation between who had back pain and who had ruptured discs. So remember that when someone says, well, of course you have pain because look what I found on your MRI, because that really may not be true. It may be that you'll have other ways to manage your pain that don't have anything to do with your MRI, so try to rebuff the feelings of threat that you get from the medical community and try to work on ways to decrease your own sense of threat through all the stuff that we've talked about today, including the meditation stuff and the breathing stuff and the cognitive behavioral stuff and the asking positive questions. All that stuff helps decrease threat. And then, of course, which we talked about, connect with other parts of yourself, too. What's really important to you, your creativity, your intellect, and the parts of you that have nothing to do with doctors and treatments. So I'm just throwing this out there, and I do want to start with a caveat that I am in no way saying that pain is not terrible. I totally understand that pain is terrible. But I just want to throw out a concept to see if it's useful to anybody. On the one hand, thinking of pain as the enemy, it's all bad. You know, it's terrible, it takes things away from me, it's the worst thing ever. Is there a way that we can get to sometimes pain may be guiding us? So maybe it's warning us of a tissue damage. So if we're starting to exercise in a particular way and we're getting pain, it's maybe telling us, ooh, that's probably not the best one for you. Why don't you back off? So thank you, pain, for telling me that. It helps give us message about how we're holding our body. So if we have a neck forward posture all the time because we're texting at the table and, you know, using our laptops improperly and sitting on the couch, and then we get pain, it might remind us, hey, you know what, you should probably have a better posture and sit up straight. It can help us make good food choices because sometimes we may have GI complaints if we drink too much coffee or we eat fatty foods, so it may remind us to eat in a healthy way. If when we're stressed out our pain gets worse, it might remind us to reach out for support. It might remind us to rest. It might remind us to, you know, go back to the things in the past that have helped us manage our stress. So I just want to throw out there the concept of pain as a guide and someone that's kind of on our journey with us trying to help us as opposed to only being the enemy. So we brought up this question before. I wonder how this experience will play out for you. And, you know, will you become a stronger person, refocus your priorities, change careers in a way that turns out to be a positive thing, help somebody else who's struggling in a way that you were before you learned some skills? And here's just a sample pain management plan. This is not one that has to be yours, but just to put it together for you, what might you do? So you want to optimize your body's healing ability by eating healthy foods, so non-standard American diet, non-inflammatory foods, by sleeping, by managing your stress. You want to use mind-body techniques that stimulate the relaxation response using things like guided imagery, meditation, Tai Chi. You want to consider aromatherapy, maybe particularly tied to your relaxation techniques as a way to deepen your relaxation. And some people do believe that the particular aromatherapy examples that I give you can be beneficial for pain directly. You want to work on your cognitive strategies, so learning to dispute your negative cognitions, like it's never going to get better and my life is ruined, by using cognitive behavioral therapy or a gratitude ritual, learning to positively reframe and ask positive questions. You want to use manual medicine to address body mechanics, so maybe a physical therapist or the targeted massage in a way that's safe, or osteopathic physician, someone else who does manual medicine. You could consider acupuncture. You could consider supplements, either ones you take by mouth or capsaicin, which you rub on the part that hurts. And now I'm done, and I'm ready to take questions. So indulge me while I try to figure this out.
Sure. Thank you for your wonderful presentation. We have about a dozen questions here to start off. And if you're able to go to the Q&A at the top of your screen and pull those questions up, you can read them out loud and then answer.
Okay. How does dysautonomia affect pain symptoms? So that's a complicated question. On the one hand, it's not necessarily directly attached to pain, meaning people can have dysautonomia and not have pain. Certainly pain can worsen dysautonomia, that's for sure. But the other thing is that dysautonomia can generate anxiety. And we know that generating anxiety increases threat, which increases pain. So in that way, it absolutely can be connected, even though it's not a pain condition per se. And so some of that change, you actually can start to work on cognitively. So by using techniques like cognitive behavioral therapy and also practicing meditation, if you're feeling kind of revved up from a sympathetic tone point of view, but you can teach yourself like, oh, that's just dysautonomia. I don't need to be anxious about that. Everything's okay. I'm going to be fine. You can use other skills to work on the anxiety that can be associated with dysautonomia. Okay. I have chronic pain and instability in almost all of my joints, but neck, back, wrists, and ankles are the worst. Chiropractic gives me the most relief, but it's expensive, and I don't hold the adjustments more than a day. What else can you recommend that realigns bones? There are multiple manual medicine techniques that can do that, so chiropractors can do that. Some well-trained massage therapists, also physical therapists, can do that. I do know that all of those modalities can be expensive if you don't have insurance that pays. Insurance will often pay for physical therapy, and sometimes the physical therapy benefit also covers chiropractic. So if you have insurance, you might try that. The other thing that sometimes can help is sometimes physical therapy schools or chiropractic schools will have less expensive clinics. The only thing there is that the people are less experienced, but they do also have supervisors, so you might go to such a place but ask to see the supervisor since you have EDS. And the other thing is that adjustments ought to be given along with exercises, because really in EDS the thing that stabilizes the joints the best is muscles. So just having somebody sort of pop you in but then not give you exercises that strengthen your muscles to help support that joint is not ideal. So you might work with a physical therapist or chiropractor briefly to say, give me some exercises that I could try myself to see if we can help strengthen the joint, and maybe the chiropractic will last longer. But pretty much it's a manual medicine technique that you're talking about, and if you don't have insurance, all of those, unfortunately, can be expensive. You could try acupuncture. It's not a manual medicine technique, but sometimes it can sort of help the body realign itself. Acupuncture also can be expensive, but some places will do community acupuncture where there'll be, 10 people in a room, and then maybe it's $10 instead of $80 for the hour, for example. Okay. I can't sleep, probably because my occiput and C1 are never in alignment. I sleep better after my chiropractor realigns them, but I can't afford to go often. I've tried a number of sleep meds unsuccessfully. Do you know of anything that may help me sleep? As I mentioned before, there is quite a lot of evidence around the mind-body techniques for helping sleep. So diaphragmatic breathing, meditation, guided imagery. Probably guided imagery, honestly, is the easiest thing because it's the most passive and it goes on for a long time. It's hard to meditate for a half an hour by yourself, but it's not that hard to listen to a guided imagery CD. So you might consider, looking at that website, which is healthjourneys.com. I know that they have several guided imageries that are specifically targeted for sleep that I would recommend that you do right before sleep. Some people do use melatonin also. I wouldn't do that without talking to your doctor first, but some people find that can be helpful and that you get over the counter. Okay. I'm having a molar extracted next week and have hypermobility type EDS. My jaw is unstable from previous injuries and EDS. What precautions should the oral surgeon or I take? He's not familiar with EDS. I may not be the best person to answer that question. I'll do my best, but my caveat is that I'm not a dentist. There certainly are a couple issues. One has to do with anesthesia, and some people with EDS have more trouble with local anesthesia, meaning it doesn't work as well. So one is just to tell your dentist that, or you might even, I know that there are some articles online, you could Google something like dental anesthesia and EDS, and I'm almost sure you'll come up with an article that you might bring and say, look, be aware that this could happen, and so make certain that I'm completely numb before you do anything. There's no question that if you have to have your mouth open for a long time under force, that can irritate TMJ. It can. But if you really also need to have a tooth extracted, I'm not sure that I can tell you how you judge that. If you have to have a tooth extracted, then you do. You might consider going to physical therapy after that, because maybe we can assume your jaw is probably going to get flared up, and you might want a physical therapist to help put it back in again. You might use ice when you get home to try to decrease any local inflammation around the joint, the TMJ joint, so the part that pops when you open your mouth, just to help some local inflammation there. I guess that's the best I've got. Okay, how do you feel about dry needling for hypermobile EDS folks? So I think it can be great. I think it's the same message basically that I gave about massage. I wouldn't want to dry needle a trigger point around a joint that's really unstable and tight muscles that are trying to keep it stable. So if you know you've injured your shoulder and your shoulder dislocates all the time and you have tight muscles and trigger points around that shoulder, don't dry needle that, because the point of dry needling is to relax the tense muscle, and you don't want to do that in that case. But for other muscles that are not currently tight because they're splinting an unstable joint but are tight for all kinds of other reasons, then it can be perfectly fine to do. And sometimes you might have to try it to know. So if you know you injured a joint, don't mess with that one. If there's another joint that you haven't injured and you have trigger points and they hurt, it's perfectly reasonable to try it. If it then leads to something else, you might say, oh, well, now I know that joint is also a little unstable. I won't do that next time, but I might do it someplace else. So the subtlety of figuring out which muscles you want relaxed and which muscles you want tight and splinted to protect a joint, that's really what you have to figure out. And for any of the muscles that you want relaxed, massage is great, trigger point massage is great, dry needling and trigger points is great, same acupuncture is great. And it turns out that there's about 80% overlap between the acupuncture map, acupoint map, and the trigger point map. So it may be that acupuncture in acupoints is a very similar thing to dry needling in trigger points. Okay. How can I motivate my 15-year-old daughter with significant EDS-related pain and little hope to believe in these techniques and give them an honest try? She doesn't seem willing or able to stick with any treatment that depends on her motivation or commitment, or that she has already decided won't work. Well, I feel you on this one. I also have 2 teenage daughters with EDS and one that had pretty significant injury and several years of being in a really dark place. So I feel you, and I completely understand this question. What I would say is maybe go over this talk with her and engage her in something she's willing to try. So the more you try to impose it upon her, because she's also just a teenager, the less she's going to want to do it. Also, I would say validating her feeling that the medical community is stupid and doesn't help is important. Because if we try to say, no, this one's going to help, and she can give you the list of the last 10 things that didn't help, you just end up fighting. But if you say, yeah, stinks. Boy, I wish there was a magic thing. And I totally get why you think this whole mess is awful and stupid and doctors are stupid, and I get all that. But, let's pick some of these things and see what you might be willing to try. So to get her to meditate on her own, I would say that would be highly unlikely. But listening to a guided imagery is a lot easier. So, if she has a phone with internet and she can pick one that she likes, try the voices out to find one that she likes, and she can just leave it on as she's laying in bed. That's something that's pretty low effort. That was one of the things that my daughter was willing to do. There's a guy with a Scottish accent that has guided imageries. If you Google guided imagery and Scottish guy, you'll get him. She liked him best and would only listen to his things. Aromatherapy is something that sometimes teenagers are willing to do. So you might get a whole pack of different ones and let her pick, what she likes and give her some cotton balls and see if she's willing to do that. Anything that gives her self-efficacy, like a TENS unit is another thing that they have home ones that you can just get on the internet that don't require a prescription. That might be something that she could try and see if you can get her to kind of make a pain management plan that is things she likes, so that she can do it without you, so it's not like you're imposing them upon her. Those were the things that worked for mine. And then the other thing I would say about teenagers in general is they pretend that they don't listen to anything we're saying, but they do. So if you even just teach stuff periodically, don't require her to say, yes, Mommy, you're right, you're so smart, that sounds like a great idea, but just say it anyway, and she may a month later try it on her own. Hang in there, Mama. It's hard. It's hard to be a mama of a child who struggles. I feel you. Okay. Tai Chi and Qigong require using diagonal movements, which I find particularly challenging to lax hips and knees. Any alternatives? They don't always. Probably the best thing, if that's an issue for you, is to take some classes with a teacher as opposed to trying to do it on your own, and speak to the teacher first, and maybe even see if you can get one private lesson with the teacher, just to say, these kind of movements bother me, but so what could I do instead? So there are many movements in Tai Chi and Qigong that are front and back or side to side. So maybe when they're doing the diagonal movement, you could just do a side-to-side movement. So I think I would meet with the teacher first and say specifically for which are the ones that have diagonal movements, this is what bothers me, what should I do instead? And then you can still go to class and then, stand in the back and just do the movements that work for you. Because there are plenty that don't require diagonal movements, and if you can do those and not the ones that bother you, then I would still recommend doing it. Okay, I have a painful ligament where my thumb connects to my wrist. This has been going on for at least 6 months. It's always tender to touch, but at least 4 times a day I lift something or move my thumb the wrong way and I have extreme pain for a minute or two. I've used naproxen it says increase inflammation, but I'm assuming you mean decrease inflammation and treat the pain, but it hasn't stopped the pain. Is this now chronic pain or serial acute pain, and what would be the best way to address this discomfort? Well, the first question I have, I guess, is has it been evaluated by somebody? Because there's sort of a baseline amount of pain that comes from a particular injury, right? So if you break your foot, it hurts. You can't meditate it away. It just hurts. So sometimes you have something that actively needs to heal or be fixed. So I certainly would see an orthopedic person, or at least maybe start with physical therapy first, and make sure that there's not something there. You can get, for instance, a ganglion cyst that can be removed. You can have inflammation around a tendon. There's various things that can do that. So I think I would start with physical therapy, see what that person says, and if you need to see an orthopedic person, just to make sure there's not an organic thing that needs to be fixed. But once that's the case, once you know that you're on the mend from an organic perspective, is it possible that after 6 months there's a chronic component? Sure, there definitely is that. But if it happens, if it's tender and when you move it the wrong way, is when the pain comes, it makes me think that there's something in there that somebody could potentially address. But you want to make sure this doesn't become a chronic pain syndrome for sure. So one of the things that could help just from the chronic pain perspective is actually giving positive touch to the area. So using a tennis ball, so some people use a golf ball, or your finger, but only if it's not actively in need of medical treatment. So I wouldn't do any of that until you see someone. If they say, we can't find anything, it seems to be totally fine, there's no reason it should hurt, in that case, then I would definitely start using the positive touch with a golf ball or tennis ball or something else. But for you, if it hasn't been evaluated, I would do that first. Is microcurrent TENS better than the normal type for chronic pain and injuries? That's a great question. They're different. So TENS has been around. TENS is a macrocurrent, a larger current. It's been around for a long time and is really used just to confuse the body about pain. It's not trying to heal anything. The microcurrent people believe and say that their products, the microcurrent products, actually generate tissue healing, because what they say is that they're giving a current that uses the kind of current that tissues use to communicate with themselves. So it's a more physiologic kind of trying to fix the underlying problem as opposed to putting a Band-Aid on top. That's what the microcurrent people say. I've looked this up, and there's some evidence. There's not a ton of evidence yet. They do use them in veterinary medicine. I'm actually just in the process of exploring one, possibly that we might use with our inpatients at the University of Maryland, because I have that same question. But here's what I do know. They're very safe, but they are different. So it would be fine even to do both, to have a TENS and a microcurrent, because they are doing different things. And I'll get back to you in a couple of years when there's more research about whether the microcurrent really works. But I'm convinced enough that they work that I'm probably going to start using it with our patients and see how it goes. So that's a great question. They're fairly new. There's different companies that use them. There's AlphaStim, Avasia. There's several different companies, and I so far can't determine that one is necessarily better than the other. But the difference between microcurrent and macrocurrent is definitely one that's in evolution in terms of our knowledge, but is probably a good idea to try. What are your thoughts about the use of opioids for acute and chronic pain? So opioids for acute pain are absolutely indicated if you have severe acute pain. And I hope I don't alienate all of you by saying this, because I definitely understand this is a complicated issue. I am not a great fan of opioids for most chronic pains, only because I have seen some really terrible outcomes. Saying that, I recognize that there are some people who feel like they couldn't possibly cope and live their life without opioids. What I would say is, for many people, and I'm not going to say everybody, but for many people, a real coordinated, integrative treatment plan using some of the things that we talked about today can often make it so that people can cope without opioids, and that is a way better scenario than using opioids for chronic pain, in my personal opinion. But I do understand there's controversy there. You mentioned not to release muscles that are tight or spasming because they're stabilizing a joint. However, PTs I've worked with say partially releasing the muscle is necessary before doing isometrics to strengthen, since it's difficult to strengthen a spasming muscle. Your thoughts? That is true. I shouldn't say that's true. That can be true. It depends on the muscle, and it depends on how much spasm you're in. So there's no question that your goal, if possible, is to strengthen the muscle to help stabilize the joint. That's for sure. And it may be that if you're working with a PT and you're actively going after a particular muscle group and you're in such spasm that you are having trouble working it, that you might need to relax it. And in doing so, there's a risk that you could sublux it or dislocate it, and that might be a necessary risk if that's what you were working on. But I do think that's different than, I just want to go for a massage and after my massage, now I've dislocated my shoulder, right? So if you're actively working on that and you recognize that you're going to try to relax it some, but you might over-relax it and dislocate, and then you'll just have to deal with that and get back on the program, that's okay, then I agree with you, that's fine. And appropriate, because sometimes you do have to risk getting a little worse in order to get better. And as long as that's not going to, put you in a state of threat and panic and catastrophizing and forget it, I can't do anything, I'm never going back to BT, like that part would be bad. So if there's a risk that if we work on this shoulder and it dislocates, that you're going to end up in that really difficult space, then maybe I would work on something else. But if the PT can get you to a place where you feel like, okay, I know what we're doing, I know that my joint may be a little unstable for a while we're working on it, and it's possible it might sublux a little, but, if it does, you'll help me and get it back in, and we'll work on it, and that will be fine, then I totally agree. Any advice on how to find a good acupuncturist? Oh, I moved too quickly. Hang on a second, sorry. Okay, sorry, engage me here. Okay, any thoughts on how to find a good acupuncturist? Because, yes, there are different kinds of acupuncturists. There's a wide range of people practicing it. So let me just tell you about the kinds of acupuncturists. So there are physician acupuncturists. So physicians can get licensed in acupuncture with less training than other acupuncturists, which doesn't mean physician acupuncturists aren't good, but it is less training than if you go to acupuncture school. You also can become an LAC, or licensed acupuncturist. You also can become a doctor of Oriental medicine, which is a much longer course, and those people learn much more about other kinds of parts of traditional Chinese medicine, not just acupuncture, although most acupuncturists learn some of that too. So there are different styles of acupuncture. There's Chinese acupuncture, Japanese acupuncture, Korean acupuncture. There's 5-element acupuncture. In general, people who are, for instance, trained in China will be very needle-focused. Other people who might be trained in something called 5-element acupuncture, which incorporates more sort of how are you doing as a person and maybe some supportive healing and counseling, that might be a very different experience. So you might go see someone trained in China, and he may not speak to you at all. He may just put in the needles and leave. The other person the 5-element person might be much more interested in, we're going to get to the acupuncture, but how are you doing? And the last thing we did, how did it help? And offering kind of a healing presence. So part of it is about style. Do you want that talking stuff or do you not? And if you don't want it, then going to someone trained in China is probably better. If you do want it, then having somebody trained in the U.S. who does 5-element acupuncture might be better for you. It's hard to say. I mean, I would say in choosing an acupuncturist, those are probably the two biggest things in terms of what makes people choose one person over another. Obviously, anytime you're doing a procedure, being experienced is helpful. So if somebody just got out of school, they may not be as experienced in complicated things than if someone's been out for a while. And then, I hate to say it, but asking around for people who liked somebody and why they liked them, and if that seems like the same reason you would like them. I had back pain and he didn't talk to me much, but boy, he fixed my back pain. Maybe you'd want that. Or maybe if someone says, oh, she's the most loving person in the world and every time I go see her, she makes me feel great and we talk about what's going on. If that's what you're looking for, then maybe you want to see that person. What are your thoughts about prolotherapy? That's a great question. It's very controversial. I just looked it up myself, and I don't know the answer, to be honest with you. There are people who are using it in EDS. The concept of prolotherapy basically is you irritate the muscles with injections, and then that kind of makes them tighten up. I think that's the idea. I don't practice it, but I think that's the general idea. The one question I have in EDS is people with EDS are irritating their muscles all the time, so why doesn't that already work naturally? So I'm really not sure. I did read one study that suggested that it made some people worse, and that, of course, makes me nervous that it would make the symptoms worse. So I completely don't know the answer. I'm investing in it myself for my daughters, and I don't know what I think about it. But if anyone here has great knowledge about it, let me know, because that's one of those that I'm trying to figure out. How do you determine which trigger points or muscles are stabilizing a joint? Is it situational for each patient, or just a matter of avoiding any muscles that are considered stabilizers versus movers? Oh, no, it's individual for the person. So the trigger point just means that the muscle is really tight, so it's a hyperirritable part of a tight muscle. So generally, if you don't have EDS, or if you're talking about a muscle that has a trigger point and you're not worried about instability at all, you would want to release a trigger point, because tight muscles make us hurt. So it's completely individual for each patient, and most people with EDS know, these couple joints are particularly bothering me, but these other ones are not so bad. Or maybe not. Maybe you don't have any joints that really are unstable and dislocate, in which case, don't worry about it. And you may be having pain from muscles that are tight and pulling joints out of whack. So in general, relaxing muscles and relaxing trigger points is a good idea, unless you have a particular joint that is being splinted by the muscles. That's the only caveat. Not okay to do TENS and microcurrent. The alpha stim microcurrent folks say use of TENS can make a person less responsive to microcurrent. So I asked that very question of the microcurrent person I've been talking to, and he said as long as you're not doing it concurrently or nearby in time, that it's fine. So there is obviously disagreement in the field, and I don't have evidence to give you one answer or the other. How do you feel about LDN? I don't know what that means, so I'm sorry, I cannot answer that question. How much does medical marijuana help with stubborn insomnia? So I don't have studies that I can quote you, but I do know that medical marijuana helps with pain. It's used more often for pain than insomnia. I don't think that even in places that allow it, that it's generally approved for just insomnia, but it certainly is approved for pain. I could be wrong about that, but my impression is that generally it's pain or cancer conditions that it's being used for. Similar to TENS, there's a unit called ARP Wave that uses direct current instead of AC. It's used for sports injuries to help with muscle recruitment and activation. How is this different than TENS? Do you think it can be helpful? I'm sorry to say I do not know anything about that, so I can't answer that question. Sorry. Oh, LDN, thank you. Low-dose naltrexone, I've had great success with it, and I do not know about that for pain. I'm sorry. What do you screen for before telling someone to treat their pain with mind-body techniques? The only real contraindications to mind-body techniques are active thought disorder. So active psychosis, schizophrenia that's uncontrolled, people who are having trouble connecting to reality probably shouldn't do guided imagery because that generates other images in the brain. Or people who are suffering from dementia severe dementia wouldn't be able to benefit, or might get confused and have their confusion of the day temporarily worsen. So that would really be the only thing. And of course, don't do things when you're operating machinery or when you're not in a safe place. If insomnia is from autonomic symptom problems, what might help? So the mind-body techniques can help. Now, there are medications, obviously, too, that sometimes people use. But mind-body techniques can be used with autonomic dysfunction just the same as if you don't have autonomic dysfunction. So they can be particularly beneficial, actually. So the autonomic nervous system that gets revved up, for whatever reason it gets revved up, mind-body, meditation, breathing exercises, guided imagery, all of those things can help turn it down so that you can sleep. I'd like to ask you about an Ayurvedic daily self-massage. I find it very helpful and economical. Are you familiar? I'm not familiar with this specific Ayurvedic massage. Certainly, Ayurveda in general is wonderful. So Ayurvedic medicine is an Indian whole medical system like traditional Chinese medicine is, and it includes a whole lot of things, including diet and meditation and massage and cleansings and other things. And in general, if that resonates with you, if the Ayurvedic teachings resonate with you, then it's terrific, and there's all kinds of wonderful things in there. So for some people, that really speaks to them. Other people, they feel like, well, those are, weird words that aren't familiar to me, and I don't want to do that. but pretty much everything you will learn in Ayurveda is pro health and wellness, and I think it's great. And I think we're about done. So thank you guys so much.
Questions.
Woohoo!
Oh, thank you for your excellent presentation. We appreciate you so much. And,
my pleasure.
And you relate so directly to all the concerns we have because your family is affected. So it's just a pleasure to have you talk with us tonight.
I really appreciate it. Thank you for having me.
And I wanted to remind everybody that Dr. Heidi Collins will be talking on October 18th. Also wanted to mention to you that our programs are funded by the Body Support Store, bodysupportstore.com, where we have products for EDSers. All of our staff is volunteer, and we are now a nonprofit, so that store helps us to fund all of our programs. We also have essential oils were mentioned, so we also have essential oils resources. If anyone's interested in that, you can email us to request a copy of a free webinar on that to learn more. Again, email us at info@edsawareness.com if you're interested in that, or if you're interested in starting a support group in your area, or if you just have any questions about our free webinars or any of our other offerings. So again, I wanted to thank Dr. Chiaramonte for sharing all of her expertise with us. And I'm going to, we really appreciate it. And I'm going to turn it over to John Furman to close out the meeting for the evening.
Yeah, Doctor, any final comments or final summary words that you'd like to share with us?
The only thing I would say is try these things. Just try them. I know it can seem like, gosh, just breathing is going to take a lot of my problems, but it's using a little of this and a little of this and a little of this really does work. I swear I've seen it work in my own house, but also with my patients. Try some of these things and see what resonates with you.
Great. Well, we appreciate that. And just want to remind everyone that we will be posting the recording and the slides on our site hopefully tomorrow. And we appreciate you attending this evening and look forward to seeing you in future webinars. And we also have over 60 on our site, so feel free to go back and look at our webinar page and look for other webinars that are related to topics that you're interested in. So thank you all for attending, and we're going to call it an evening. So good night, everyone. Thank you.
Thank you. Have a good evening. Take care.
Thanks. Good night. Bye-bye.